Hi everyone, this 2024 quiz program, as the first quiz of this year, I've initiated with the X-ray. As we all should know, radiology department had been initiated with our grandfather and the discoverer of radiology and imaging science in the medical field. Please go through the already given video above if you're interested. Let's go to the quiz now. First of all, I thank all the 16 participants. I appreciate a lot. It's the enthusiastic participation who always encourage any question answer session. Here is the quiz session. It will be really enthusiastic to have more and more number of participants in the coming weeks. We'll go to the answer of the first quiz now. So I'm giving X-ray knee. I'm talking about the X-ray knee of 48-year-old gentleman in a road traffic accident. It shows a comminuted displaced patellar dashboard fractures, multiple fractures. You can see that. An extensive suprapatellar swelling is seen, which indicates hematoma. And in comparison with the other soft tissues, you can see at the suprapatellar swelling, there is decreased density, which is suggesting lipohemoarthrosis, and I think everybody would know. And nothing else could be commented in this limited view of X-ray knee lateral view. Now we go to the old findings in the X-ray pelvis. You can see that. So the first one is complete loss of right femoral head and neck. The second one is superior migration. There is superior migration of the femur, and with iliofemoral pseudoarthrosis. And you can see right hemiatrophy of the muscles, bony pelvis, and the femur. Now we'll go to the findings in the X-ray leg, which has been given in AP view. You can see mid-third fibular osteotomy defect, and there is thin bony reformation in the osteotomy. There is no soft tissue thickening, and you can see that tibia and the calf soft tissue appear normal. So now the findings in toto would be, now you can see that road traffic accident, there is comminuted displaced patellar dashboard fractures. The second one is the old one, which is loss of femoral head and neck, fibular osteotomy. Due to the preservation of distal femur and the leg bones and the muscles, poliomyelitis has been ruled out as it causes total neuromuscular loss in the entire right lower limb most of the times, even though some exceptions are there. Loss of femoral head and neck, in the presence of fibular osteotomy, we should think about the cleanliness by seeing the cleanliness in the upper femoral diaphysis. It might be due to surgical debridement. Fibular osteotomy indicates cortical grafting, whereas iliac osteotomy usually indicates cancellous grafting. And for 2 decades, total hip replacement is the rule, which has not been done here, and that indicates that this should be at least 20 to 30 years back. So the diagnosis is usually either septic hip arthritis or avascular necrosis of hip. So the main issue is the patient had no previous reports, but he told that he had undergone a surgery many years back and had been told as due to severe sepsis and arthritis. And initially he had no limping. Progressive painless limping has been there for many years. He never had any trouble while traveling through TVS 50 for many years. So with all the above findings and the findings in the given x-rays, the final diagnosis, one is comminuted displaced patellar dashboard fractures. The second one is surgically corrected septic hip arthritis by removal of femoral head and neck with cortical grafting by mid-fibular osteotomy. He also had superior migration of the femur with iliofemoral pseudoarthrosis. So that's the final diagnosis. It's the great involvement by the 16 participants in this first quiz of this. And of the 16 participants, I thought only one could be considered as the winner. He is Dr. Chetan Vaishnav, radiology resident in Vadamalan Hospital. I sincerely congratulate the winner. I would applaud for the other participants and congratulate in the coming weeks. Let's love radiology imaging.